Hi, everyone, and welcome to yet another edition of our MJS BioLinks Breathe and Learn. I'm Steve McKend. I work in business development at MJS BioLinks, and it's a real privilege to introduce our guest to you today. Marco Leu is the Chief Operating Officer at ABC biopply, but I like to refer to him as the 3D cell culture guru. Marco is joining us today to share how you can increase the predictive power and accuracy in your preclinical disease models using the 3D cell culture platform, 3D CoSeedis, a platform which offers an alternative to animal testing and can help you accelerate your drug discovery efforts. So as always, it'll just be a quick 15-minute demo. You can ask questions in the chat box below or wait until after the session. We'll have 15 minutes of Q&A then. And as some of you may know from previous sessions, we love to keep it personal here at MJS BioLinks. So if you're comfortable doing so, feel free to change your Zoom name to your real name by simply clicking on those 3 dots on your tile. And if you're feeling extra dangerous, you can turn your camera on as well. And while you do that, a few reminders. First, this session is being recorded and we'll be able to share it with you right after the session has ended. And out of courtesy to everyone on the call, I'm going to mute all of you. It's nothing personal, but if you'd like to ask questions afterwards, after the demo, please go right ahead and unmute yourself. And with that, I will pass it right off to Marco. Enjoy.
Well, thank you. Good morning to everyone. Thank you for the nice introduction. I'm excited to be here today and to have the opportunity to present to you our latest advances in our effort to provide predictive and animal-free preclinical models for drug development. I will do so by presenting the benefits of ABC biopply services and assays exemplified by one of our recent customer-tailored projects. But before we start, let me say a few words also about ABC biopply and introduce you to the topic of current drug discovery. So ABC biopply is located in Switzerland. We actually have our headquarters in Solothurn, which is the northwestern part of Switzerland. Our service and logistics center is in Cham, which is near Lucerne. And we also do have some clinical facilities in Freiburg in Germany. Now, speaking of which, when we look at the current drug discovery and development process, we find that initially promising new compounds very often fail in the later stages of clinical testing. In fact, if we set the value of new drugs that successfully pass preclinical testing to 100%, as we do here, almost 90% have been sequentially eliminated by the end of clinical phase 3. And this situation is obviously highly dissatisfying and inefficient. And it is also accompanied by an enormous loss of time and money. Now, one of the major reasons this overall process is so inefficient lies in its linear and sequential setup. The traditional setup of drug discovery and drug development is in principle a linear process, as I said, where the result of an upstream test phase leads to the starting point of the next downstream test. However, the limited number of input compounds, the incapability of currently used 2D models in pre-selecting active compounds effectively, but also the fact that the discovery load currently lays mainly on PDX or other animal models, and the lack of any quick feedback output reduces the overall effectiveness of this process and prolongs the entire development cycle. Unfortunately, this also adds substantially to the overall costs of drug development. And this is where ABC biopply now comes in with its 3D CoSeedis services and assays. In contrast to the traditional drug development process, with ABC biopply, we can now create a cyclic feedback loop or feedback interface, we call it, that provides accurate data and drug efficacy quickly and reliably. ABC biopply services, therefore, allow to process and adapt newly discovered compounds fast. They provide much better predictions on dosage, toxicity, and efficacy and consequently feed downstream in vivo or clinical tests with more reliable drug candidates. Now, at the core of ABC biopply services and assays is the 3D CoSeedis in-chip technology. Physiologically relevant 3D disease models increase the predictiveness, accuracy, reliability, and consequently add only confirmatory character to PDX and other animal models. Overall, the implementation of ABC biopply's 3D CoSeedis in-chip technology can reduce the time for the preclinical test phase from 4 years up here to as little as 3 months, and cut the costs by a factor of 10. So why is it that we achieve such a striking result with 3D CoSeedis in-chip technology and lift drug development to the ex vivo level? Now, the trick is in the topography of the 3D CoSeedis chip and the way the microtissues within the chip can communicate with each other or underlying feeder cells. As you can see here in the middle, or on this middle panel, individual cells sediment into microwells where they aggregate into 3D constructs. They support each other by exchanging growth factors or other signaling molecules that freely diffuse through the matrix of the 3D CoSeedis chip, and therefore allow communication between the individual microtissues. Furthermore, we can also grow those chips on top of so-called feeder cells, for example, in 2D, as is shown here, or in even more complex 3D configurations. And those then also add to the support of the 3D constructs above. At the same time, such a setup also allows us to investigate cell-to-cell or even organ-to-organ communication in a simple yet easy to analyze way. This chip-wide communication is responsible for the formation of highly homogeneous and uniform 3D microtissues across the entire chip. But it also accounts for the physiological resemblance of patient-extracted or to patient-extracted tissue. One example to assess physiology in ex vivo formed tissues is cell density. And if you look at a cancer tissue from a patient, for example, you realize that the cells within the tumor are quite densely packed. However, if you grow microtumors in ultra-low attachment plates, for example, the density is comparatively much reduced. In 3D CoSeedis chips, however, this density of such microtumors is increased again and resembles the appearance of tissue derived from patients. So in this respect, 3D CoSeedis does indeed lead to the generation of physiologically native microtissues. And this has a direct impact on the way these tissues react to compounds, since it actually affects cell surface receptor expression, drug penetration, and general drug response of individual cells within the aggregate. Now, to look at the impact of those features that I've just presented on drug development, I would like to introduce ABC biopply services and assays in further details. In principle, we offer 5 broad categories of services to our customers. First of all, there's a quick target validation package. This includes highly accurate IC50 determinations and the transition from 2D to 3D in-chip assays. The package also delivers highly sensitive and accurate dosage data for downstream in vivo experiments. Another package consists of our unique long-term drug efficacy assays, using some unique features of the 3D CoSeedis in-chip technology, about which I will tell you more in just a few slides. This package addresses ex vivo long-term drug efficacy and exposes potential drug resistance. Our drug safety package then uses custom-defined primary microtissues to determine off-target toxicity effects and gives valuable hints on potential side effects and efficacy windows. The personalized drug efficacy and toxicity package takes the on and off-target dose response a huge step closer to the patient by using primary patient-derived cells to build relevant disease models for accurate preclinical predictions. And finally, ABC biopply's pathway package addresses the analysis of drug functionality and signaling pathways by using specific assays to uncover the drug's mode of action. In the next few slides, I would now like to present some of our 3D CoSeedis in-chip assays in further details. And let me start with the 3D CoSeedis cytotoxicity in-chip assay that allows accurate and reliable IC50 determinations and serves as a nice example on how different those values can actually be depending on the complexity of the setup. Now, traditionally, a lot of cytotox assays have been performed on 2D cell cultures. And in such an assay, we normally have triplicates, quadruplicates, or even more samples that are measured. And each of those are at each individual dosage here. Now, each particular data point, therefore, is subject to uncertainty defined by both the biological variance between each measured sample and the systematic error inherent in the experimental design. When we now move to the 3D CoSeedis cytotoxicity in-chip assay, the first apparent difference is the number of microtissues measured per data point. Now, in contrast to the 2D setup, here we measure about 600, or we integrate the signal of 680 microtissues. This high number confirms an unprecedented statistical relevance to the data and renders biological outliers insignificant. The second apparent difference between flat and our 3D models is the change in some of the IC50 values. Now, as you can see, for some compounds, the determined values are identical between the two approaches. So, for example, tamoxifen here, but also carboplatin have the same IC50 value in both systems. However, for the ADC, so the antibody drug conjugate Kadcyla, there is a significant shift to higher concentrations in the IC50 value. Now, interestingly, this higher value is in perfect agreement with in vivo and clinical data. And in summary, the 3D CoSeedis cytotoxicity in-chip assay therefore provides highly accurate and reliable prediction of such IC50 values with high statistical relevance. If we look at the 3D CoSeedis dose response assay, this is also a very interesting assay for multiple reasons. First of all, it is a highly sensitive and accurate assay to describe the effect of compounds on the disease model over time. Again, the assay profits of the unique in-chip design and allows us to average growth rates of 250 microtissues or more per individual data point, which again, of course, makes it statistically highly relevant. Furthermore, it is capable to detect minimal changes in dosage. For example, here in tamoxifen, there's a nice example of just 1 micromolar intervals. In contrast to current state-of-the-art PDX or CDX models here, the assay is also a lot faster. Whereas normally treatments in the in vivo situation may take up to 45 days and are even unable to distinguish certain conditions, the 3D CoSeedis dose response assay delivers statistically relevant data in just about 8 to 10 days. It is therefore not only providing results quickly, but also eliminates the need for costly mouse experiments entirely at this stage. As a unique feature, ABC biopply also offers ex vivo long-term drug efficacy assay. As indicated in my introduction, the 3D CoSeedis platform allows us to detect drug efficacies with a high accuracy. Again, we average about 400 microtumors per data point in this assay, and we address questions such as tumor relapse or drug resistance over time. This is possible because the in-chip technology allows the identification of stochastic and rare events. Both are the case with relapse and resistance. Furthermore, the platform also allows long-term studies of up to 12 weeks, which is the time it sometimes takes for relapse or resistance to occur. In this case here, we looked at potential late-stage tumor relapse, again with tamoxifen and carboplatin, where both compounds do not show any tendency to relapse. It became clear, however, that they have a severe effect on tumor compactness shortly after their application. As indicated here in the red circle, both compounds loosen up the tissue initially, giving the entire tumor a rather large appearance, which is correlated with an increase in the detected volume. This effect can also be observed in-chip bright field microscopy, and some examples are indicated by the red arrows here in this panel. This loss in tissue compactness indicates that both substances could be beneficial in combinatorial treatments in patients, since they may facilitate tissue access for partner compounds. And this is in fact exactly what is reported from clinical practice for carboplatin as well as tamoxifen. When we look at Kadcyla with the same 3D CoSeedis late-stage relapse assay, we realized that there was no response to the ADC at all at this chosen dosage here. In contrast, in an early-stage relapse assay, where the ADC was added to the microtumors right after their formation, we do see growth arrest. However, it is only transient, and the volume of most microtumors is increasing again just after about 4 to 5 days. Now, this is a nice example here where for certain dosages, we are able to observe a clear tumor relapse phenomenon. Such a test can therefore give us an indication on later stage in vivo responses and help identify and narrow the most effective dosage window. Oops, one back. When we look at, no, here we go. So now the 3D CoSeedis in-chip technology also allows us to address off-target toxicity in a variety of microtissues, depending on where targeted epitopes, for example, are expressed or toxic effects are likely to occur. Shown here are just 2 examples of liver and kidney, where off-target toxicity was assessed via the 3D CoSeedis cytotox in-chip assay on corresponding primary cell-derived microtissues. And the readout here profits of physiologically relevant tissue responses to compounds tested, and therefore helps us again to fine-tune dosage recommendations for in vivo and clinical studies. Now, taking this all together, ABC biopply's servicing packages deliver accurate and precise and reliable dosage recommendations for in vivo and or clinical studies. they are more precise in their predictions than current technologies and do not require animal tests. Furthermore, the results are available fast and therefore allow a cyclic feedback loop early in the development process to either eliminate, improve, or advance compounds before they enter costly in vivo and clinical study programs. And with this, I would like to end today's session. I thank you for your interest, and I'm looking forward to an inspiring discussion.
Thanks, Marco. If there are any questions, you can throw them in the chat, or you can unmute yourself and just ask Marco directly if you'd like. We have one coming in from Mohammed, Marco.
Mm-hmm.
He said, excellent talk. I was wondering, this 3D CoSeedis system is how economic compared to conventional in vivo experiments? There's a two-parter, so I'll ask you, you can answer that part first.
Well, as I mentioned initially, of course, it depends a little bit on the extent of the in vivo and the ex vivo test programs that we've set up. But in general, when we do current, for example, cytotox and dose response assays, we are in generally up to 10 times more cost effective, so 10 times cheaper for the same result. And this is related not only that we don't need animals at all to achieve the same results, but which by themselves are very expensive, but also because we reduce the time it takes from start to end of the experiment by, well, quite substantially. So that all adds up together, of course. And if we consider that, for example, some of the in vivo tests need to be repeated, then the factor will be even higher. Because whereas we can test relatively quickly and get results relatively quickly, the entire process to redo animal experiments is, of course, very, very expensive.
Great. The second part to that is, are there any peer-reviewed studies published on the system?
Pardon, could you repeat that? You dropped out for a second.
Sorry, are there any peer-reviewed studies that are published?
Yeah, yes, we do have studies published. Actually, the best would be to go to our website. There is a link there where you can find all the relevant references. There are general publications on the technology. There are publications in different areas in the field. So that would be the best. I can send the link also for you to distribute to your customers.
Yeah, excellent. We can reach out to you directly, Mohammed, and send those right over.
Mm-hmm.
Nothing else in the chat right now. Any other questions?
Hi, Marco. I would
Hello.
like to thank you. Hello, it's Nihal talking. I would like to thank you for the presentation, and I would like to ask one question that I always receive from the customer regarding the Agoras gel CoSeedis material. Would be nice to hear from you. How could be effect on the biological samples to using 3D CoSeedis as the Agoras base gel?
Yes, we're using pure agarose as a carrier for the matrix of the 3D CoSeedis chip. Agarose has been used in cell culture since 3-4 decades already. And there is no interaction between cells and agarose. Agarose simply can't. They can't adhere to the compound agarose, nor can they digest or cleave agarose into monomers. So it's in that respect biologically inert. And there are many publications on that as well, which are really decades old already, where people have looked at this in the past.
That's great. Thank you for clarification. And if I have still time, Steve, can I ask one more question?
Go
Actually,
right
it is like something I always receive again in the market. There are a few other 3D cell culture technology. Like if we compare like with the another spheroid macro well plates, which is low attach plates. What is the main feature and advantage to using 3D CoSeedis compared to assay, like a downstream assays?
Well, for us, this question is to some extent not so relevant, really, because we are mainly offering a service. So we're not really selling our platform as such. The advantage for us, of course, is that we, first of all, the service or the platform is proprietary to us, which gives us a lot of flexibility in adjusting it to customer requirements. And of course, there are some technical advantages as well compared to plastic regarding transparency, regarding permeability for factors, and so on and so forth. But it's mainly the combination of all these and how we integrate it into our assays that gives us a cutting edge on competition. And the way, but you know, since we're not really a technology company as such, but rather a service provider, there's not, you know, not really a direct comparison to plastic ware as such, for example.
Awesome. Thank you. I'm all done for the question now. I'm sure there are a few questions going to come up again, but it's always great to have you to support us.
Thanks a lot. It was great.
Thank you for being with us.
Thanks to you guys. If there are future questions, as always, I'm more than happy to answer them with additional calls or by email.
Excellent. Well, thank you, Marco. We really appreciate it. And thank everyone else for coming. We hope you're as inspired as we are by this technology. And as Marco said, please don't hesitate to reach out to us with any questions, or if you'd like to schedule a one-on-one conversation with Marco for your application. And your rep will be in contact with you right after this session to confirm we have the correct address for your Timmy's card as well. Thanks, everybody. Thanks, Marco.
Bye-bye.